طيب بسم الله الرحمن الرحيم. Thank you all for being here. I know we're coming after lunch break, so I'll try to go through my presentation, hoping that I find my words will find their ways in the proper mindset for everyone. طيب بسم الله. I don't wanna. This is just a quick introduction about Saudi Arabia. What we're trying to say here, Saudi Arabia is a large country. We have 13 provinces. Some of them are very rural areas. They are not all as developed as equally to each other. So regulating medical devices in this large area is not something simple and easy. It's a challenge. There was no governmental body responsible for regulating medical devices. We started actually from zero, from scratch. There was no rules, no regulations, no body regulating medical devices, which is a situation where some of the countries might be there, some have passed that already. In 2003, a royal decree, the Council of Ministers established a decree forming the Saudi Food and Drugs Agency in Saudi Arabia. And in 2007, the first law for Saudi FDA was issued. And in 2007 as well, the Council of Ministers resolution on regulation of medical devices, what we call the interim law, was issued. And this is the law that has been governing our work since 2007. And this is actually what gives us the power to execute our work around the kingdom in regulating medical devices. Our mission is to ensure safety, effectiveness, and quality of medical devices and their performance in accordance to the intended use. In accordance to their intended purpose, and to ensure the safety of related electronic products. The royal mandate, by the way, is not exclusive to medical devices. It includes other devices, as we are going to see. We had to start setting up a medical device regulatory scheme. We had to start implementing it, enforcing it. We had to start licensing products. We had to start monitoring the market. We had to do all the regulatory activities from scratch. A medical device. A medical device ranges from cottons to an MRI to a nuclear medicine device. Somebody is waving. To a nuclear medicine device, to a cyclotron, to a cotton, or surgical instruments, or simple things. So a medical device is a large, wide spectrum, and regulating this is not something trivial. It's a challenge. And of course, devices could be used for diagnosis, prevention, or treatment, or even replacing some body organs or other things. These are the devices that we regulate: medical devices, IVD devices, prescription eyeglasses and lenses, contact lenses and their solutions, radiation emitting electronic products. So even X-ray and radiology devices are regulated. This is our structure. The structure is formed in a way to have a separate department associated with the life cycle of the device, beginning from design until design, and then going to the market, and then going into the hospital, and then including that we are going to see as we proceed in the presentation. 20 minutes, so I have to rush. I have somebody behind my back. 17 minutes, so 17 plus 8, 25. Medical devices, interim regulations. So in what we did, if you go to our website, sfda.gov.sa, there is a section for medical devices. All our regulations and laws are over there. We have the interim regulations, and then the national provisions, and we wrote our implementing rules, and then guidance documents associated with these implementing rules were issued. We have tried our best to join international parties and to be harmonized with the world in developing our regulations. So we have adopted the GHTF guidances, and through our participation with international bodies, we are trying to ensure that we are in alliance with the world regulations in general. Of course, the purpose is to protect and maintain the public health within the Kingdom of Saudi Arabia through our interim laws and regulations. Our interim regulations apply to local manufacturers, international manufacturers, authorized representatives, importers, and distributors. And we will go over the role of each one separately as we proceed in the presentation. All medical devices and their accessories that are going to be dealt with within the kingdom need to be regulated by us. Who knows, by the way, who didn't know that not a single medical device is supposed to enter through the boundaries of Saudi Arabia without being registered at Saudi FDA? Who didn't know that? Everybody knew? طيب, this is good. But we still have people who are coming on the borders, showing up with devices, claiming that we didn't know that we are supposed to register. And that's a challenge. And then they put you on the spot, and they say you are blocking our business, and you're taking it out of business, and we didn't know that we are supposed to register. Well, yani, I don't know. What can we do about that? In the interim regulation, no medical device may be placed on the market or put in service without complying with our provisions and interim regulations. This is something everybody needs to adhere to, and we always do our best in responding quickly to the demands and requests for market authorizations. What can we do if somebody doesn't comply? We can suspend their license, terminate their license, recall the product, and if there is suspicion of fraud or forged devices or fake devices, we send it to the legal authorities to take actions against those who do that. And we many times we face this challenge. Actually, we face challenge that in certain countries, when you request for any technical document, they are willing to give you any document you want. You ask for proof of registering here or there, in 1 second you will find it. How do they do that? Hopefully they are truthful. But many times we figure out that there was some forged documents that were submitted to us through our systems. We have implementing rules all published on our website. And by the way, this is a 4-day event. The first 2 days are open to public. The third and fourth day, the delegates from different countries will be visiting us in Saudi FDA, and they will see all our systems, all our regulations in details. And then we will develop a workshop in which we will have a roadmap to establish laws within each country in general. These are some implementation rules that we have. Conformity assessment bodies that we collaborate with, establishment registrations, medical device listing, establishment listing, authorized representatives, the documents required when you submit an application for market authorization. These are some of the implementing rules that are available on our website that could be viewed for it. We also issue guidance documents to help the applicants and our regulated customers. We like to call them regulated customers, and how do they use our systems and how do they use our programs. These are some of the guidances: importers and distributors, local manufacturers, authorized representatives, overseas manufacturers. So anyone interested in any document related to their work, they can download it and read it and apply. These are the implementing rules. At the top you see the life cycle of a device that begins with conception and development and moves from the manufacturer to the vendor to the user. And we have medical implementation rules that cover the whole life cycle of the device. So we begin with the design process, where we evaluate the technical files of the devices before they enter into the kingdom. We give them market authorization, and then we monitor them while coming across the borders. And once they are in service, we also do the post-market surveillance and some studies in general. Now, in doing this work, we are collaborating with several conformity assessment bodies to help us in the evaluation and validation of these submitted documents. We have UL, Cosmos, TUV, and BSI. They are full-time available in our office in SFDA. Those of you who will be visiting us in the 3rd and 4th day will maybe have a chance to see them. And we collaborate together to evaluate the technical documents and technical files. They help us in authenticating the documents that are submitted by the factories, and we usually engage in discussions in evaluating the technical documents associated with any device before it is placed into the market. Now, we do all this through electronic systems. People don't need to. We're moving towards paperless systems. Factories and manufacturers and distributors don't have to come to our office unless they have technical questions. They could upload all their documents. They could do all their applications online without the need for coming to us. We haven't reached 100% paperless systems. We are moving towards that. I think we are about 70%, I should say. The bulk work is done electronically, and we have a lot of electronic systems that govern our work, and they are also accessible through our website, and there are guidances associated with each electronic system. How do you use it? How do you apply to it? What are the different steps and elements involved in doing that? Now, this is why I was rushing, because this map tells you the whole story of what we do in Saudi FDA. So please bear with me. This is a story, by the way. As we proceed, you will see how our work is done. So this is the Kingdom of Saudi Arabia, and Saudi FDA is in the middle. And this is the life cycle of medical devices that begins with concept and design, and then the concept and design move to the manufacturing, and then packaging and labeling, and then it is imported to Saudi, it goes to the site, it is underused, and then deposited. So that's the whole life cycle of a medical device, and this is what we do in Saudi FDA. Importers, distributors, healthcare providers, and local manufacturers, and authorized representatives all must register their facilities and register their services in a system what we call Medical Device National Registry System. Anyone who is dealing with medical devices, healthcare facility, authorized representative, and we will speak about authorized representatives. Actually, all international factories, all factories interested in sending their devices, selling their devices in the kingdom must have an authorized representative in the kingdom. This authorized representative will carry the technical documents, the technical files, and will be responsible for submitting these documents to Saudi FDA, and will also be responsible for tracing these devices within the kingdom in case a recall takes place after it's in the market. So, authorized representative. So, an international factory may have one authorized representative with multiple distributors. So, the person in charge in front of Saudi FDA legally is this authorized representative, who also needs to register in this Medical Device National Registry, this system. Now, we have an overseas manufacturer who's interested in selling their devices within the kingdom. So they have to submit a technical file, a technical document, and apply to the classification system. Is it a medical device or is it not a medical device? That's the first thing to identify whether it's a medical device or not a medical device. So they apply through our electronic system for this classification to identify whether there is it's a medical device or not. Once classified as a medical device, then the overseas manufacturer must appoint an authorized representative in the kingdom and apply through what we call medical device establishment license. So the factory must have an establishment license and an authorized representative before they even submit their technical documents. They haven't. First, we figured out it's a medical device. Now they have to register themselves and their authorized representative in the kingdom. So this is done through a contract agreement between the factory and the authorized representative. We have the legal format available. If it's approved, we evaluate the qualifications of this authorized representative and also some documents related to the manufacturer, and we license the authorized representative. Local manufacturers do not need authorized representatives. They can proceed directly to applying for what we call MIDMA, Medical Device Market Authorization. This is our bulk work. Medical Device Market Authorization is the system through which devices are given a license to be marketed in the kingdom. So the authorized representative and local manufacturer needs to submit the technical documents, the technical files through the MIDMA system to be evaluated by SFDA. And once the technical file is approved, a MIDMA is issued, a market authorization is given to the factory, by the way. The market authorization is given to the factory, so this factory may have 10, 15, 20 distributors around the kingdom with one authorized representative. Now, if there is an importer who's willing to import these devices from this factory, they have to have an establishment license, and they need to apply through the establishment license program to give their what is their company, their storage area, their qualifications of employees, and then we have an inspection team that visits this establishment to ensure that the storage facility is proper, that they exist. So now we don't have this problem, but when the inspection teams began going into the market, you'll be surprised to what we figure out to be a medical device importer or distributor where it just doesn't exist. Improper storage facilities and many other problems. I don't think we will have time to go over some of the interesting discoveries we find out in storage areas and false documentation. But then, once the importer and manufacturer and distributor, the importer and distributor is licensed, then they can start importing their devices, and they have to list the devices they would like to import through our Medical Device National Registry. So the Medical Device National Registry has a listing of all the devices that are coming into the kingdom. That's the MDNR, what we call it, the MDNR. This is the listing. First you obtain the market authorization, and then you list the devices you would like to bring into the kingdom in this MDNR system. And then the importer custom clearance system, yes. Now the importer will ask the international factory to obtain an authorization for importing devices into the kingdom. I mean, the medical device clearance system, they need to import their data. In this system, you say, I'm interested in sending the following shipment to Saudi Arabia. It consists of the following items with the following MIDMA number. The authorized representative is so-and-so. The importer is so-and-so. We have all these numbers and all these documents listed through the system, and these devices reach to us on our ports, where our ports, at the port of entry, we are present at around 13 or 11 port of entries. We have our people over there, and once a shipment arrives, the Saudi Customs transfers the medical device file to us, and we ensure that this shipment has a market authorization, and it has an authorized representative, and it is listed in the MDNR, and the distributor has a valid establishment license. Once this is done, the product is cleared from the market, from the ports, and it goes to the healthcare provider facility to start using. Now, we are also, some of the devices are not, like for example, research centers. Some research centers, we are kind of lean, and we ease up some of the requirements on them. They can import for research purposes, not for marketing purposes. So we have a system called MDIL, a medical device import license. In this MDIL, IVDs and reagents and many chemicals go through this without the need for having a full comprehensive study of the technical file. So this is the import license. The stuff is imported. The devices is in used. Now we have the National Center for Medical Device Recall. We have the recall system where we have people, residents, citizens, hospitals, authorized representatives, factories must register in our system. And if they monitor or see any problem in a device that is design related, they have to report it. And we have inspection teams that go and investigate this incident and this problem. If based on this investigation, we issue a recall, local-wise recall, and we inform the factory. And in this recall, we contact the authorized representative for this device and ask this authorized representative to give us a listing for the hospitals that are using this device, and then we follow up with the correction plan implementation with the authorized representative. In many cases, some international alerts come out based on observation coming from Saudi FDA, from our National Center for Medical Device Recall. This is basically the story of what we do at Saudi FDA. It's not everything. We also regulate radiological departments, radiological X-ray departments. We visit hospitals. We ensure that they are following the standards of radiation safety standards. We ensure that they use TLDs, they have proper shielding, that there is quality assurance system, and we have the power to close down the X-ray department if they are not in compliance. We also regulate advertisements, clinical research, and recently we are also starting our own laboratory systems where we're going to start to do some testing locally for post-market testing for some of the devices that constantly show trouble. This is our website, again, sfda.gov.sa, medical device section. A lot of what I said is already there. Feel free to visit. And if you have any question, medical device sector, MDS, at sfda.gov.sa. Feel free to raise any questions anytime. Thank you.